Greetings, I am Daisy Rosero. I am an MPH candidate and researcher at the University of New Mexico College of Population Health. Today I'd like to share with you the results of the Health, Safety, and Psychosocial Organic Farming Survey. This is a regional study funded by the Southwest Center for Agricultural Health Injury Prevention and Education at UT Texas at Tyler. It was administered to organic producers in 5 states monitored by the Southwest Ag Center, and those are Arkansas, Louisiana, New Mexico, Oklahoma, and Texas. This author has nothing to disclose. Organic farming is one of the fastest growing sectors of the agricultural industry. More Americans are buying local and organic, more organic operations are being certified. 3 out of 4 conventional grocery stores are carrying organic products. So the demand is increasing for locally grown organic products for the restaurant industry and household consumption. But despite the growth, little is known about organic farmers' safety practices or their health behaviors. Organic operations are predominantly small family-run farms. The USDA defines a small farm by income, so operations with an income under $350,000 are considered small farms. More than 88% of U.S. farms are classified as small farms. And this is important because small farms and fresh food producers are more vulnerable to disruptions in the food system. Agriculture is one of the most hazardous industries, and an illness or an injury can have a really devastating effect on a small farm. Data related to agriculture is collected across various surveillance systems. It's often aggregated or combined with other sectors, and no one system collects comprehensive data. And this makes it challenging to understand health risks on a micro level. Moreover, this information relates to the work environment. The Bureau of Labor Statistics reported agriculture, forestry, fishing, and hunting workers suffered over 18,000 non-fatal occupational injuries and illnesses in 2018, and that resulted in days away from work. 63% of those were from animal and crop production. Little information exists on health or prevention behaviors specific to organic farmers, even less about organic producers, and we don't have a complete picture of the life and living conditions that may also contribute to injury and illness. The purpose of the study was to identify and typify health and safety risk among organic producers and to provide information on psychosocial and contextual factors that may contribute to injury and illness. Psychosocial factors refer to characteristics that affect attitudes and behavior, and the social and contextual factors of people's life and work. This was a cross-sectional survey of certified organic producers administered over 8 months. It was developed with expert input, and we used the socio-ecological model to organize the conceptual model for this survey. The final survey has a total of 179 questions. We recruited through the USDA Integrity Database. We collected data through REDCap, which is an IRB-approved web-based data management and data collection platform. And we also distributed paper surveys. We conducted a descriptive and correlation analysis for this preliminary analysis, and we calculated Cronbach's alpha to measure internal consistency of several scales. Approximately 600 organic operations were listed in the Integrity Database. After exclusions, 499 qualified operators were invited to participate, both electronically and on paper. 118 operators returned the survey, which is about 24%, and ultimately 97 records were used for analysis. Following is a snapshot of preliminary results. We will be taking a deeper dive into the data in the spring. Demographically, almost half of the respondents were younger than 55. Over a third identified as female. They were predominantly non-Hispanic, white, married, or cohabitating. Less than half had a household of 2 or more, so about 65% lived alone or with only one other person. 69% had a 4-year college education or greater. A little more than half of the respondents were new or beginning farmers. and a little less than half the farmers were smaller than 50 acres. 46% of the respondents had an annual income over $100,000, and most had health insurance. When asked about health perceptions, for overall health, most reported good and very good health. Mental health was rated higher than overall health, with more people reporting excellent mental health. When comparing perceptions of risk between organic farming to conventional farming, most said that the risk of injury and illness were about the same. Organic farming versus non-agricultural jobs, a third said other jobs had a greater risk of injury and illness, and a little over a third said that it was about the same. Overall satisfaction was high. Notably, respondents were less satisfied with organic farming than with work or life. When asked about work-related injuries in the past year, 52.2% of respondents experienced at least one injury while working on the farm. About a third reported losing work time due to an injury. The Bureau of Labor Statistics for 2018 reported non-fatal injuries for crop producers at 35%, although the BLS figures don't distinguish between conventional and organic production injuries. When asked about safety behavior, respondents reported never using safety shoes, sunscreen, and ear protection at higher rates than all the other safety equipment. These may be potential areas for education. For stress associated with organic farming, finances, future of the farm, amount of paperwork, and farm policy legislation were reported as areas of high stress. In the often always category, responses related to social networks and community were highest for questions on staying informed about social and political issues, learning new things, and understanding the views of others. Respondents reported less social participation and mentorship to others for the same category. We calculated Cronbach's alpha for several scales in the survey and found high inter-item reliability across scales. We found that the social responsibility scale was positively correlated with both the organic farming principles and the reasons for being an organic farmer scales. Correlations were also found for the organic farming principles scale and the reasons for being an organic farmer scale. The organic farming principles scale was also correlated with job satisfaction. There was high inter-item reliability in our psychometric testing. Perceptions of risk were reported as being greater for non-ag jobs and about the same for conventional and organic farming. There may be opportunities for health promotion around safety practices. Future finances and administrative tasks were reported as areas of high stress, and there were positive associations between scales. Limitations. This is a self-reported cross-sectional study, so it doesn't provide longitudinal data, but may serve as a baseline for future studies. The sample was small, so it may not be representative, but the response rate was typical of most survey studies. We used an electronic approach to recruitment, but that may not be best suited for this population. In conclusion, the study generated much-needed data about organic producers and may contribute to our understanding of occupational health, safety, and contextual factors of health. The results of the study could potentially inform research practice and policy.